Your doctor recommends renal therapy, which means that your kidneys are not functioning properly. Healthy kidneys filter out waste excess fluid and electrolytes like potassium and sodium from the blood. This waste exits the body through the urethra as urine. If you have a kidney disease, your kidney gradually loses function. This leads to an accumulation of excess waste and fluid in the body, which can cause problems such as bone, blood problems, and even blood pressure. So what is dialysis? Dialysis is a procedure that is used to remove waste product from your blood. It can be done to treat acute kidney failure, which means that your kidneys stop working suddenly, or to remove certain drugs and poisons from the body. There's a type of dialysis called hemodialysis, in which a doctor will use a dialyzer to clean the blood outside of your body. So immediately when you hear outside of your body, then you're thinking there is a type of dialysis that can clean the blood inside of your body. That is peritoneal dialysis. First, let's understand hemodialysis. Some weeks before, your doctor will prepare an access site on your body in order to do an arteriovenous graft or an arteriovenous fistula. What happens first? The doctor will use anesthesia to numb the area. In the case of an arteriovenous graft, a small incision will be made in the forearm in order to access the artery and connect it to the vein. And this is done using a small plastic tube. However, for the arteriovenous fistula, a small incision is made in the skin to connect the artery to the vein. Only when this access vascular point is healed, then can the dialysis begin. The nurse will insert 2 needles into the arteriovenous fistula or the arteriovenous graft. The blood then exits slowly out of your body into the dialyzer. So when inside your body, your blood will encounter filtering fibers and absorb on cleaning solution. This is called the dialysate. And the dialysate then removes excess waste and electrolytes from the blood. Remember, there are 2 needles. So the second needle now, so the clean blood will travel from the dialyzer via the tubing back into your body. And when this is finished, the needle is removed and you can go home. So a soft tube known as a catheter will be implanted into your abdomen near your belly button, in which the dialysate will enter and exit the abdomen. And this is known as a peritoneal dialysis. So do you understand, in this type of dialysis, all the waste is drained out on a continuous basis into a disposable bag? Understanding dialysis, don't you think that it is time for us to visit a dialysis center? Let's go to Peruvo Dialysis Center. We are with Dr. Sean Lynch, a transplant nephrologist at Mount Hope Hospital, a well-renowned nephrologist in Trinidad and Tobago. And Dr. Lynch, I'll jump right into it because renal failure is so common lately. How does a doctor differentiate from transplant to dialysis?
Ultimately, transplant is the aim of renal replacement therapy. So when your kidneys fail, there are options including dialysis and transplantation. Ideally, we would prefer if patients avoid dialysis completely and they get a transplant. That's what we call a preemptive transplant. So where we've been following a patient who has been having chronic kidney disease, their kidney function is deteriorating, and we've determined that if we don't intervene soon, they will end up on dialysis. Now, we always consider each patient for transplantation, but clearly not everybody will be eligible for transplantation. A number of factors, including their age, including their underlying status. If they have severe disease that may not warrant them to be a transplant candidate, if they have a recent malignancy in terms of cancer and stuff. What we aim for is to provide a better quality and longevity in terms of life, but not every single patient with end-stage kidney disease will be eligible, particularly because of other factors
such as the waiting time.
Well, the waiting time is sort of different because when you say waiting time, it means that you have already established that that person is a transplant candidate. And now they just simply have to wait until an organ becomes available in terms of a deceased organ. Now, to avoid that, if patients have been deemed an eligible transplant candidate, they can have a living donor. In other words, someone comes forward and they say, I'm interested in donating a kidney to my whoever, friend, wife, husband, daughter, son, and then we will work that potential donor up to see if they are eligible in terms of they must be well enough to be able to survive with one kidney for the rest of their life. And that's a better situation because in that situation, you actually have an identifiable donor. And once they are able to pass through the screening process, there's no wait time. The wait time really applies to those patients who we have deemed to be eligible, but they simply do not have a donor, and therefore they have to wait for a deceased donor, which is someone who has died.
And that's my next question. What is the period of time to use a deceased donor kidney?
Once you have determined that there is a potential deceased donor, the quicker you get that organ out and put it into the potential recipient, the better. We tend to get very good deceased donor organs, partly because of the type of patients we get from the ICUs in Trinidad.
Dr. Lynch, now we see a correlation between hypertension, between heart failure, as well as diabetes. What accounts for these correlations? Because there's a strong correlation between kidney disease and diabetes.
Well, that's quite simple. We are eating ourselves to death. That's literally what we're doing. These are all lifestyle diseases by and large. Yes, there are some people who have some unfortunate disease processes that lead to renal failure, but the number one cause of kidney failure in this country is type 2 diabetes.
Could you repeat that again?
The number one cause of kidney failure in this country is type 2 diabetes. And these diseases are fully preventable with proper management and care. Part of the problem with kidney failure is that there are no symptoms. And there are no symptoms until you're very late in the game. So people think they are well, but they are quite sick. They may not be feeling sick, but on the inside, they are quite sick. And our culture is one where we only go to the doctor when we have a pain or we're feeling sick. So you can have good going advanced kidney failure and you have generally no symptoms and you feel you're well, but you're quite unwell. And that's part of our problem. And therefore, when we have a symptomless disease, one of the major things we have to do is screening. So we know patients who are diabetic have high risk for kidney disease, so we are supposed to be checking for it, whether they have symptoms or not. And that has been a failure of our medical system here in Trinidad and Tobago. And therefore, far too many people are turning up with end-stage irreversible kidney disease, learning for it for the first time, and then I'm speaking to them about dialysis, which they have no idea about, and we are in a rush and a panic situation, rather than a controlled situation where we are seeing, hey, this is getting worse, things are getting worse over time, and we can prepare a bit more.
So now let's talk dialysis. Yes. We do understand this is an artificial procedure to do what the kidney should be doing, that is removing excess waste and fluid from the body. How do you differentiate in your professional perspective between peritoneal dialysis and hemodialysis?
That's quite simple, patient choice. PD and hemo are equally effective. When you look at the data, they're equally effective. And therefore, the number one driving factor is patient choice. Although there are some limits to peritoneal dialysis. So, peritoneal dialysis is where we put a catheter and we use a natural filter within the abdomen called the peritoneum to get rid of toxins. People who have had major surgery to the abdomen before, the catheter tends not to work. So I kind of sway them towards blood dialysis. And that's a function of our system and stuff more so as well. So there are some limitations with regards to peritoneal dialysis, mainly access issues. There are a lot of myths about limitation to peritoneal dialysis, meaning you have to live in a nice area and have running water. And these myths have been thrown out. You know, you just have to be able to sanitize your hands. Everybody's been sanitizing their hands with COVID going around.
Yes.
Because it's a closed system and then everything is all sterile. Even blind people do peritoneal dialysis abroad. There are systems where there's a click system and you can hear so that you could know how to operate. So it's quite effective. It's no less effective than hemodialysis. However, hemodialysis still remains far more prevalent than peritoneal dialysis, particularly because for peritoneal dialysis, you have to do it yourself. Some people, that's affair. Some people just aren't able to because of advanced age and that sort of stuff.
And also time management. But now we have some good news. We heard the Perivo Dialysis Center is offering nocturnal dialysis. So while you sleep, the body removes the excess waste.
Yes.
Tell us about the advantages, if there are any, on nocturnal dialysis.
Oh, there's significant advantages to nocturnal dialysis. What you really need with kidney failure is a kidney.
Yes.
You need kidney function. What nocturnal dialysis does is that it gives you that time. Time is of the essence. There's certain toxins which are not easily measurable, which need time to be removed because of their size. And therefore, with a standard 3.5 hour or 4 hour dialysis session, they aren't effectively removed. Nocturnal dialysis allows that time period for it to be removed. It also allows us, because you are getting so much function, that we can slow down the process a little bit. So it's a bit gentler, a bit more physiologic, because your kidney doesn't work where it just goes on full 100 for 4 hours and then have no function for 2 days.
Yes.
That's essentially what we're doing with dialysis. Your kidney works on gently tickling over, getting rid of stuff slowly over time. So, conventional dialysis is like putting the human in an osterizer and just blending quickly and then having nothing for a couple of days. Whereas the nocturnal process, because it is longer, it allows it to be slower. It allows fluid removal to be slower. And thus, it's more mimicking the natural process.
And it has the psychological advantages as well, because the patient at that time seems more relaxed. You could sleep. I saw the comfort line on downstairs there. Besides that, in terms of dialysis, immediately when you think dialysis, we think about acute kidney failure. But dialysis can also be used to remove drugs and toxins from the blood, yes?
There are certain toxins where we would have to use dialysis to remove them. Quite honest with you, I can't remember the last time I had to do that in Trinidad. That's, there's a particular toxin that is used when people try to commit suicide.
Yes.
So in North America, you will have that in Trinidad. We do use it in that situation, but that's really not very common. To be quite honest with you.
Dr. Lynch, talk to the viewers who are watching. We have viewers from Trinidad and Tobago, Antigua, Barbados, as well as Jamaica. What lifestyle changes would you like to see us Caribbean nationals engage in?
First thing I would like is for us to take responsibility for our healthcare. Our diet is horrible. It needs to change. Our portion size needs to be reduced. And our exercise regimen needs to be improved. There are lots of people who tell you they exercise. Doc, yeah, I exercise. If you really watch what they do, they're not really increasing their heart rate. They're walking very slowly, old talking. We need to take complete command of our lifestyle, because these diseases can be preventable. We are having a real crisis in terms of diabetes and obesity, leading to heart disease and kidney disease and even increased incidence of cancers. So we need to get our portion sizes down, we need to eat cleaner, and we need to exercise more. If, unfortunately, despite that, we are diagnosed with diseases such as hypertension, diabetes, we need to take ownership of it. Patients need to be involved in their care. They need to know their medications. They need to know what's their HbA1c. They need to know what they need to do and what they don't need to do. Of course, healthcare providers are here to guide, but ultimately, the responsibility falls to the patient, because the person who suffers at the end of the day is the patient.
And we are with Samson Acevero, Clinical Director here at Peruvo Dialysis Center. And we understand that kidney is a silent killer. However, here at Peruvo, they offer, I think it's the only one in Trinidad, I stand to be corrected, that offers nocturnal dialysis. And now the patient can sleep, and the process is going to the dialyzer. And they feel refreshed, wake up in the morning, and they have the whole day for themselves. More centers should offer nocturnal dialysis. But besides that, what separates your dialysis center from any other dialysis center on the island?
At Peruvo, we focus on only dialysis and kidney failure, making our patients healthy and giving them a normal life as possible. You're not going to go back to normalcy, but we try to give you a situation where you are pretty normal.
Yes.
And you can go about your activities of daily living without having any issues. We offer nocturnal for many reasons. One of them is a lot of patients, when they get kidney failure, they tend to want to quit their jobs.
Because it changes their lifestyle. And not knowing that nocturnal dialysis is available, because dialysis takes a long time. You have to understand that. So for how many hours? 4 hours, 6 hours? How many hours exactly for hemodialysis?
The nocturnal dialysis goes for about 6 to 8 hours. Everything slows down. Pump speed slows down, gentler on the body. A lot of patients who suffer from a lot of heart issues and cardiac problems tend to go on dialysis, and it's recommended to be on dialysis. Why? Because eventually your heart can give up. So with nocturnal, it's gentler on the body, it's gentler on the heart, and it prevents the patient from going into any cardiac arrest sooner rather than later.
We understand that dialysis removes the potassium and the sodium that the kidney would normally have to remove.
Correct.
Yes? But what I saw downstairs is that the patient looks so relaxed. I actually get to witness the nocturnal dialysis, seeing the patient going through the procedure, sleeping and looking. That state of comfort is something irreplaceable. Because you know, normally when you are sick, there's a psychological imbalance that can occur with a level of anxiety, a level of, am I going to make it? A concern about your general health. And this is what I would say the main advantage of nocturnal dialysis.
Correct.
However, there are several dialysis centers that are killing people daily. And when I say that, I'm not going to call any names, of course, I don't have any court close. However, in doing my research, I saw that Perivo Dialysis Center was top rated in Trinidad, as well as people from other islands were coming into Trinidad to come to your center.
Yes.
What would you say give you the competitive advantage? What are you doing differently?
Customer service, patient focus. Two major roles. And when you do this job, you do it from your heart. You do it from your heart. That's the 3 keys. If you are offering this service and you are helping patients and you are giving in your all, our nurses are well trained, well qualified, and they have a heart for the patients. Amount of time and effort that we take to get our patients to the state that they are currently in right now, where they are looking so well and you don't even know they're on dialysis.
And I saw that you have a wealth of equipment here.
Yes.
Earlier you explained to me that dialysis will do 20% of the job. So now it is also the patient's responsibility to augment their lifestyle choices.
Correct.
I wouldn't say, well, Mr. Severo, well, I'm doing dialysis in the evening, well, in the night, and I'm going to eat anything, drink anything, and allow your machine to clean me out. And some of them, sometimes this is the approach. Is this the message that you're sending to them? Or are you saying that, yes, the dialyzer is doing 20%, but the next 80% is your lifestyle choices? Yes?
Correct. I will say this to the patients and the listeners out there who are on dialysis or have been diagnosed with kidney failure. Let me tell you guys something. Don't feel that when you come to a center and you get on that machine, that once we hook you up and you start to dialyze, it solves all the problem. It does not solve all the problem. Our kidney does a lot of different activity. I'm talking about from maintaining your blood pressure, regulating it, remove all of potassium and phosphorus, and I could go on and on. So when you come to dialysis, you have to do your part. Make sure you do not stick with your lifestyle that caused you to be on dialysis in the first place. Adjust your lifestyle, adjust your diet. I have patients who have been on dialysis for over 15 years, 20 years, and they have no problem.
Who finances dialysis?
Well, it have multiple streams of financiers. It have the Ministry of Health, most of all, that actually finance patients that can't afford it, and one who may have health insurance. Perivo Dialysis are partners with pretty much all the insurance companies. Providers in the Caribbean.
Yes, because with technology, of course, there's a combination of science and technology, and we have to stay abreast. And generally, Samson, in the Caribbean, we tend to have a third world approach, even sometimes to medical, have outdated, older machines. But here I saw downstairs at Perivo, you have new, updated machines. When I look, and I did some Google research, you know, Google is our best friend. And I'm looking at these machines and I'm saying, well, now let me come here and see what equipment that you have. Being able to see the same equipment in your dialysis center was a source of refreshment. Yes?
Wonderful. Yes. So again, Perivo focus on patient care, and we are always looking to be the trendsetter in dialysis. So when you all think about dialysis, the first thing that should come to you
Think Perivo.
is Perivo dialysis.
What I noticed as well is that there is a socialization that was taking place for the hemodialysis patient, because they form a bond because of a commonality of experience. And I see with your staff, there was a kind of family-oriented environment. There was a comfort that I even felt, the energy of that comfort. I felt it entering that room. The patient, because we have a similar experience, so we can bond together. We can talk about, what I am going through and what you are going through. And there was some bit of socialization and integration with that group that you're promoting. And I must say to you, well done.
Thank you.